Hello everyone, and welcome to our latest phlebotomy study log. This video focuses on the chapter on preanalytic variables and venipuncture complications. And I have 27 questions prepared for us. For each one, hit that pause button and see if you can figure it out before I go over the answer. I hope this helps. Let's get started. Number 1. What are preanalytical variables, and what is the phlebotomist's responsibility for them? Preanalytic variables are factors that affect specimen integrity before analysis. The phlebotomist is responsible for minimizing the effect of these variables to the greatest extent possible. Number 2. What must be done if the patient is not in the room when you come to collect a specimen? If a patient is not in the room when you come to collect a specimen, every effort must be made to locate that patient by checking with the nursing station. Number 3. What hospital protocol is followed when you are supposed to draw blood from a patient who is not wearing an ID bracelet? If a patient is not wearing an ID bracelet, contact the nursing station so that one can be attached by the nurse on duty. Unless an ID band is on the patient, you must not draw blood. Specific policies regarding the resolution of patient identification problems may vary from institution to institution, so be sure to follow the policy of your institution. Number 4. How is an unconscious patient approached for blood collection? Unconscious patients should be treated just as you would conscious ones. Identify yourself and describe the procedure. They may be able to hear you, even if they cannot respond. Number 5. Name 6 potential barriers to communicating with the patient. Potential barriers to communicating with a patient include sleeping or unconscious patients, the presence of physicians, members of the clergy, or visitors, apprehensive patients, language problems, and patient refusal. Number 6. Define hemolysis. Hemolysis is the destruction of red blood cells, resulting in the release of hemoglobin and cellular contents into the plasma. Number 7. Define occluded and describe what occluded veins feel like. Veins that are occluded are blocked. Occluded veins feel hard or cord-like and lack resiliency. Number 8. Describe where the tourniquet is applied when performing a dorsal hand stick. When performing a dorsal hand stick, the tourniquet is applied around the wrist below the antecubital fossa. Number 9. What antiseptic must be used when collecting for a blood alcohol test? Povidone iodine must be used when collecting for a blood alcohol test. Alcohol can adversely affect test results. Number 9. List 4 things that can cause hemoconcentration. Hemoconcentration can be caused by a tourniquet that is on longer than 1 minute, pumping of the fist, sclerosed or occluded veins, long-term IV therapy, or dehydration. Number 11. What symptoms might a patient exhibit immediately before syncope? Before syncope, a patient's skin often feels cool, damp, and clammy. Number 12. How can you correct the position of a needle whose bevel has stuck to the vein wall? If a needle's bevel has stuck to the vein wall, slightly rotate the needle to correct its position. Number 13. What can cause a vein to collapse during a blood draw? Too much vacuum on a small vein can cause it to collapse during a blood draw. During the syringe method, it may occur when the plunger is pulled too quickly. Number 14. How many venipuncture attempts by a phlebotomist are usually considered acceptable? The policy at most institutions is that a second try is acceptable. After a second unsuccessful try, another phlebotomist should be found to draw blood from the patient. Number 15. How can a phlebotomist prevent reflux of an additive during collection? Reflux of an additive during collection can be prevented by keeping the patient's arm angled downward so that the tube is always below the site. allowing it to fill from the bottom up. Also, remove the last tube from the needle before removing the tourniquet or needle. Number 16. List 5 reasons specimens may be rejected. Reasons specimens may be rejected include no requisition form, unable or mislabeled specimens, incompletely filled tubes, defective tubes, collection in the wrong tube, hemolysis or clotted blood in an anticoagulated specimen, contaminated specimens and containers, and improper special handling. Number 17. If a stat test is ordered and the patient is not in his or her room, you should locate the patient. Number 18. Which laboratory department may require special patient ID? Blood bank. Number 19. Collapsed veins can be caused by 1. Too large a needle for the vein. 2. Too much vacuum is exerted on the vessel. 3. The plunger is being pulled too quickly. Number 20. Which of the following could be a cause of hemolysis? Vigorously mixing the tubes. Reasons for specimen recollection include all of the following except prolonged bleeding after needle withdrawal. Number 22. Conditions that may alter the quality of a specimen or cause harm to the patient during a blood draw include the following. 1. Edematous tissue. 2. Mastectomies. 3. Hematomas. Number 23. Povidone iodine is not recommended for blood gas draws. Number 24. Hemolysis is destruction of blood cells. Number 25. Lymphostasis is lack of lymph fluid movement. Number 26. To enhance vein prominence, you can apply a moist warm cloth to the area. Number 27. Hemoconcentration is alternation in the ratio of elements in the blood.
Thank you for watching. Don't forget to subscribe to our channel for more content.